So another one of our pitfalls that we deal with is our documentation, ruling out sepsis or time stamping when sepsis is diagnosed. So sometimes a patient will come in for other reasons or reasons other than sepsis, yet they meet sepsis criteria. How can a doctor go about making sure that sepsis is ruled out?
Sure. So we have a lot of patients who come in who technically meet sepsis criteria but don't have sepsis because they don't have an infection. Whether that's something like pancreatitis, heat stroke, even patients who have come in with cardiac arrests where, yes, technically they meet sepsis criteria because they have, abnormal vital signs, elevated lactic acid, maybe elevated white blood cell counts. Sometimes those patients will be admitted and then later on sepsis will be added to the diagnosis as if it was done on admission. And so what we can do in those situations to help meet the metric or help avoiding a situation where it's diagnosed inappropriately is making sure that we document that sepsis was not present or that sepsis was ruled out while they were in the emergency department. And so that will help us with that metric specifically, and it also shows that that wasn't the reason that the patient came in. We've all been frustrated when that happens, especially when it's, a cardiac arrest or something completely unrelated, and maybe the patient develops sepsis later on in their course in the hospital. And so making sure that we document it and just being aware that if the patient has other criteria for sepsis or SIRS, that later on that may be added on. And so we need to show that while they were in the emergency department that wasn't the case. And it's as easy as just documenting sepsis was not present or sepsis was ruled out. The other cases where, let's say, somebody comes in for something unrelated and then later on we do diagnose sepsis, maybe they didn't have any SIRS criteria, maybe they didn't have anything specifically, then we still document. We may not get credit for all of the metrics, but at the very least we do get credit for some of the metrics at that point. And then making sure that we still follow through with the antibiotics, blood cultures, lactic acid, and the appropriate fluids.
Yes, thank you.